Hey guys, this is Dr. Hub. Today we'll look at the zero versus the first order of kinetics. So first of all, in the zero, what do we have? So in the zero order, there's a constant amount of drug. There's a constant amount of the drug. So this constant amount of the drug is eliminated per unit time. It is eliminated per unit time. Then comes the rate of elimination. The question on the rate of elimination. So this is totally independent of the plasma concentration. So this is going to be independent. So it is independent of the plasma concentration. Next comes a question on the clearance. So in terms of clearance, it's more at low concentration. The clearance is clearly more at lower concentration, and it is less at the higher concentration. Next comes a question on the half-life. The half-life, if you see, it is less at low concentration. It is less at the lower concentration, and it is more at the half-life is more at the higher concentration. So what are the drugs of zero order? The drugs are, it is very few, which follow the zero order kinetics, the mnemonic being watt power. So what does W stand for? The W stands for the warfarin. W is for warfarin. Then comes A. A is for the alcohol. So A is for the alcohol as well as the presence of the aspirin. Next we have T. The T is for the tall butamine. The tall butamine as well as the theophylline. So it is the tall butamine as well as the theophylline. Then comes the P. This P is nothing but for the phenytoin. Now we look at the first order. So in terms of the first order, they have the constant fraction of the drug. So first order, there is a constant. This is nothing but a fraction. There is a constant fraction of the drug. So in first order, F for F, that is a fraction of the drug, is eliminated. Fraction of drug is eliminated, and this is eliminated per unit time. Then comes the rate of elimination is proportional to the plasma concentration. The rate of elimination, if you see, it is proportional to the plasma concentration. Next is the question on the clearance. The clearance is considered constant. And what about the half-life? The half-life is also considered constant. And what are the drugs under the first order? So it contains most of the drugs. Most of the drugs follows the first order kinetics. So now let's quickly just plot a graph. So in terms of the zero order elimination, zero order. So in the x and y axis, so in the x axis it comes the time, and then the y axis we have the plasma concentration. So if you look at the graph, there is a decrease in the graph with the time. And next, when you look at the first order kinetics, so in terms of the first order, there is the x axis and the y axis. X axis is the time and the y axis is the plasma concentration. So here there is a decreasing slope which is seen in terms of the first order kinetics.